Good morning, everyone. Today, January 4th, 2022, we have 418 active cases in the region. Due to the shift in the pandemic response announced by the province of Ontario last week, PCR testing is no longer available for everyone with symptoms. Publicly funded PCR testing is now available for those in high-risk settings, including vulnerable individuals or those with significant medical issues who are symptomatic or at risk of severe illness from COVID-19, including for the purposes of confirming a COVID-19 diagnosis to begin treatment. Those who live, work, visit, or admitted into the highest risk settings, such as hospitals, long-term care homes, retirement homes, and congregate living settings. And other specific groups, such as people who are from First Nations, Inuit, and Métis communities, and people traveling into those communities for work. This shift means that our testing numbers and positivity rates will not be an accurate representation of cases in our area. The more important statistics to pay attention to would include percent positivity, number of hospitalizations, and number of outbreaks in high-risk settings, as this information more accurately represents the impact of the virus on our region. We will also see a shift in contact management. Positive cases in high-risk settings, such as long-term care homes and retirement homes, will receive full case and contact management, but other cases will be asked to identify and inform their own close contacts. Under this new provincial guidance, anyone with symptoms who fails the screening tool and is not eligible for testing should assume they have COVID-19 and self-isolate as recommended by the tool. The screening tool should also be used when someone is identified as a close contact. It will provide information on whether or not you need to self-isolate and for how long. Self-isolation requirements have changed and can be as short as 5 days depending on the situation. For the general community, individuals who are vaccinated as well as children under 12 will be required to isolate for 5 days following the onset of symptoms. If you're 12 and older and unvaccinated or partially vaccinated, or if you're immunocompromised, the isolation period is longer at 10 days. Yesterday, the Government of Ontario announced many new restrictions as we re-enter a modified version of the Step 2 of the roadmap to reopening. This is due to the increase in hospitalizations that are being seen across the province. We will be assisting local workplaces, businesses, and organizations as needed to ensure they are following all of the new measures that apply to them. Some of the changes that come into effect Wednesday, January 5th include social gathering limits are 5 people indoors and 10 people outdoors, 50% capacity for retail settings and personal care services, no indoor dining at restaurants, closure of indoor sports and recreational facilities, and remote learning until at least January 17th. I still have a bit more. Vaccination remains our best protection against the virus. Nearly 160,000 doses of the COVID-19 vaccine have been administered in our region. We continue to offer vaccination clinics throughout the region and have large-scale clinics running throughout January and February. The eligibility requirements have recently changed, and effective immediately, residents of long-term care homes, retirement homes, elder care lodges, and older adults living in other congregate settings are eligible for a 4th dose of an mRNA vaccine if at least 3 months have passed since the 3rd dose. Northwestern Health Unit has vaccination appointments available to book into, and local pharmacies and healthcare providers are also offering the vaccine. You can visit our webpage at www.nwhu.on.ca/COVID-19 for more information about our vaccination clinics.